are 10 Puerto Rico Medical Board-style clinical vignettes focused on gastrointestinal GI anatomy and physiology, with 4 answer choices and detailed explanations. Gastrointestinal anatomy and physiology clinical vignettes. 1. Esophageal peristalsis and swallowing disorders. A 58-year-old man presents with difficulty swallowing both solids and liquids, along with regurgitation of undigested food. Barium swallow reveals a bird's beak appearance. Which structure is dysfunctional? A. Lower esophageal sphincter. B. Upper esophageal sphincter. C. Cricopharyngeus muscle. D. Pyloric sphincter. Answer A. Lower esophageal sphincter. Explanation: achalasia is caused by impaired relaxation of the lower esophageal sphincter, LES, due to loss of inhibitory ganglion cells in the myenteric back plexus. 2. Gastric acid secretion regulation. A 45-year-old man with peptic ulcer disease is given omeprazole. Which of the following directly stimulates parietal cells to secrete gastric acid? A. Gastrin. B. Secretin. C. Cholecystokinin. CCK glucagon. Answer A. Gastrin. Explanation: gastrin, from G cells in the antrum, directly stimulates parietal cells via the CCKB receptor and also stimulates histamine release from ECL cells, leading to acid secretion. 3. Small intestine nutrient absorption. A 30-year-old woman with celiac disease has iron deficiency anemia. Which part of the GI tract is most affected? A. Duodenum. B. Jejunum. C. Ileum. D. Colon. Answer A. Duodenum. Iron is absorbed in the duodenum. Celiac disease leads to villus atrophy, primarily affecting duodenal absorption of iron and folate. 4. Enteric nervous system control. A 2-day-old newborn presents with failure to pass meconium and abdominal distension. Biopsy of the rectum shows absence of ganglion cells. What embryologic structure failed to develop? A. Neural crest cells. B. Somites. Mesoderm. D. Notochord. Answer: A. Neural crest cells. Explanation: Hirschsprung disease is due to failed migration of neural crest cells to the myenteric Auerbach and submucosal Meissner plexuses, causing a ganglionic megacolon. Hana 5. Pancreatic enzyme secretion. A 65-year-old man with chronic pancreatitis presents with fatty stools, steatorrhea, and weight loss. Which enzyme is most directly responsible for fat digestion? A. Amylase. B. Lipase. C. Trypsin. D. Pepsin. Answer B. Explanation: Pancreatic lipase is the main enzyme for fat digestion. Chronic pancreatitis leads to exocrine insufficiency, causing fat malabsorption and steatorrhea. 6. Bile acid function and enterohepatic circulation. A 48-year-old woman with Crohn's disease has fatty diarrhea. Which part of the GI tract is most responsible for bile salt reabsorption? A. Duodenum. B. Jejunum. C. Ileum colon. Answer C. Ileum. Explanation: bile acids are reabsorbed in the terminal ileum. In Crohn's disease, ileal inflammation or resection impairs bile acid reabsorption, leading to fat malabsorption. 7. Hormonal regulation of gallbladder contraction. A 40-year-old woman with gallstones experiences abdominal pain after eating fatty meals. Which hormone stimulates gallbladder contraction? A. Gastrin. B. Secretin. C. Cholecystokinin. D. Vasoactive intestinal peptide. Answer C. Cholecystokinin. Explanation: CCK released by eye cells in the duodenum and jejunum stimulates gallbladder contraction and relaxation of the sphincter of Oddi to facilitate fat digestion. 8. Large intestine water absorption. A 65-year-old man with chronic diarrhea is found to have excessive colonic fluid loss. What ion is primarily absorbed in the colon to maintain water balance? A. Potassium. B. Bicarbonate. C. Sodium. D. Calcium. Answer C. Sodium. Explanation: the colon actively absorbs sodium via ana-C epithelial sodium channels, which helps maintain fluid balance. 9. Splanchnic blood flow and portal hypertension. A 58-year-old man with a history of alcoholic liver cirrhosis develops esophageal varices. Which venous anastomosis is responsible for variceal formation? A. Superior mesenteric vein. Inferior mesenteric vein. B. Splenic vein. Renal vein. C. Left gastric vein. Esophageal veins. D. Portal vein. Hepatic vein. Answer C. Left gastric vein. Esophageal veins. In portal hypertension, blood is diverted from the portal system to systemic circulation, causing esophageal varices via the left gastric vein, esophageal veins, a zygos system. 10. Gastrocolic reflex and motility. A 28-year-old man has increased urge to defecate after meals. This reflex is mediated by which hormone? A. Motilin, B. Secretin C, gastrin, D. Cholecystokinin, CCK. Explanation. The gastrocolic reflex is triggered by gastrin, which increases colonic motility after eating. Key takeaways for GI anatomy and physiology. Esophagus. Achalasia equals less dysfunction, bird's beak sign. Stomach. Parietal cells secrete acid regulated by gastrin. Small intestine. Duodenum absorbs iron. Ileum absorbs bile salts. Large intestine. Sodium absorption maintains fluid balance. Liver and biliary system. CCK triggers gallbladder contraction. Portal hypertension. Left gastric vein. Esophageal varices. Would you like another set